we kind of looked at ourselves, my wife and I, and kind of thought about, well, where would we want to raise a family, and where would we want to kind of lay our roots for the long term. We didn't think that Washington, D.C. really was where we wanted to be, and so we looked for places to go and ended up in Vermont. I think one of the things we love about Vermont is kind of the sense of community that we have here, because we know that tobacco is the single most preventable cause of death for all of our patients. At one level, it's between you as a doctor and your patient, and you are clearly somebody who provides them with scientifically based evidence and recommendations to them what it is that puts them most at risk and what it is that they can do to get themselves healthier. And so that's why it's so important that any physician taking care of a patient recommends to them that yes, they should stop smoking, and yes, that gives them the tools that they need to stop smoking, whether it be nicotine patches, other drugs, and ensures that they get adequate information about how to quit and the support that they need. I think that a physician can oftentimes use resources that are available to them to actually get people moving in the right direction, apply that reinforcement they need. So it doesn't take a lot of time. I think it's important that they hear that from the physician, though, in terms of that it should be something that they try to stop smoking. And I think there are resources available, whether it be quit lines, 802quits.org. And I think it's really important that physicians understand that it has to be more than just that one piece of advice. It has to be the reinforcement that you give every time. You have to understand that it's not easy. I think everybody understands that nicotine is an addiction, and that kicking that habit is not an easy thing, and oftentimes it will take several times for your patients to quit. I think as importantly, understanding how busy physicians are these days, it's really important to have the systems in place to make it so easy for them to do it. So whether it be it's the connecting to a system of quit lines, of cessation products that makes it really almost no-brainer for docs to do.